everybody. This is February 2021. This is our OSL Health Ministry forum. I want to take a minute to just welcome Linnae, Frank, and Alyssa.
Hi, Deb.
Hi, Jan.
How's it going?
Good. Nice to see you.
Nice to see you.
Good to see you. It's been a while.
It's been a while.
Linnae and Alyssa are our speakers today. It sounds like a bunch of you know Linnae, which is awesome. For those who don't know, Linnae is our, she's a registered clinical exercise physiologist. Linnae, I want to make sure I get that right. And I may get your title wrong here, but I think of you as the director of cardiopulmonary rehab at Red Cedar. Is that fair?
I'm not quite the director. We're our team, so we have supervisors, then directors. So
gotcha. So you're the
I organize.
Perfect.
I'm just like the part of the organizing team, and we all work together. Yeah.
Awesome. And then Alyssa, I was learning a bit about Alyssa's background. Alyssa is currently self-employed and the owner of Limitless Wellness Health Coaching. She's got a background in dietetics and exercise physiology as well. And the two of them are tag teaming today to present their program, Your Heart Healing from the Inside Out. So I am going to just try to pin them to the main screen here, and then I will pass the floor over to them for their presentation. We'll open it up to some questions and discussion near the end, as we always do, with our goal to be out by about 10:40 or so everybody has a chance to transition to the radio church service. And I see you're bringing up slides here. I don't know who's driving. Is that Linnae or Alyssa?
Alyssa's driving for us. She's my driver.
Nice. I just want to confirm, can everybody see the slides?
Yes.
Yeah. Okay, awesome. Well, Alyssa and Linnae, thank you so much. I will pass it over to you.
All right, thank you. So I am going to start out first. I'm Linnae Frank, and I got Dr. Horvath just introduced me, and I work at Mayo Clinic at Cardiac and Pulmonary Rehab. And I decided I want to talk about cardiac rehab, but there's many things I also wanted to add to it. And part of that was partnering up with my very good best friend, Alyssa Gawboy. And we started out, and thankfully she said yes, because she really brought something pretty special to my life personally, and I just thought it was a big part to bring into my rehab to my patients. When we were talking about like what are we going to talk about for our presentation, we were obviously FaceTiming and kind of joking and laughing, and I'm like, well, when I start talking, especially about the heart, cardiac rehab, I can get a little bit medical or technical. And I wanted to keep it kind of fun and joking around. And then Alyssa is so funny. She said, well, let's keep it lighthearted. So, of course, we laugh and we think we're funny. So that's how it's going to be for a moment. So hopefully I can keep this as lighthearted as I can. There will be certain things that maybe, they have questions about or whatever. And then I'm going to go through quite a bit, and then I'm going to hand over especially to Alyssa because of the joy that she's brought into my life and to many, actually, hence why she has her own business now. So we've been celebrating, it's February's Heart Month. And during that time, we have Cardiac Rehabilitation Week, where we celebrate cardiac rehab in many ways. Cardiac rehab comes together. It basically is a medically supervised program, and it's so important part of your recovery from having a cardiac event or procedure to help prevent future heart issues. We have a team of exercise physiologists and nurses that work within the rehab, but we also have a variety of people that work and help and volunteer to come in and talk to our patients, where there has to do with nutrition, if we have to refer to psychotherapy issues, or the physicians, obviously. Just as a couple of things too, with cardiac rehab, you have to have a referral from a doctor. So some of the diagnoses, well, the main diagnosis, if you had a heart attack, heart failure, your valve repair, replacement, open heart surgery, PCI or stents, heart transplant. So those are things that are covered by insurance, and that's the key thing, and it has to be a certain diagnosis. Part of this too is I just want to give it's so important with our diet, basically our statements, or our heart disease is a leading cause of death right now in the US. Besides, we're not talking COVID today. Well, we can, and then every 40 seconds, someone has a heart attack. And then nearly 1 in 2 US adults here have hypertension, yet 1 in 4 only have control of it. So all of this, I'd really like to prevent before they can get into cardiac rehab. A lot of this is prevention too, which I'll kind of talk about later on, how exercise is really going to affect and help with heart disease. So cardiac rehabilitation, and then next slide, I'll just give you kind of a nice little diagram, what we include. So we're creating exercise programs for people who are adopting healthy hearts, heart healthy diet, reducing stress, stopping smoking, obviously medication and medical therapy is super important, and reducing stress. And then next slide, Alyssa. What is important to that cardiac rehab can do is lower your chances of a second heart attack or heart surgery, reduce overall the risk of dying or having future cardiac events, lessen chest pains, because we're always medically supervising, and there's a way, like maybe chest pain is coming and going, and if you're not in rehab, we wouldn't know that, and that could happen on your own by yourself, or you're in a supervised area where you're experiencing things. And then obviously we take forward and then move to the physicians and say, hey, this is happening with our patients. We're trying to get control of your risk factors like blood pressure and cholesterol, and even weight loss. So it's kind of the gist about this program. There's many things that we include, obviously education, counseling, and the skills development for having a heart healthy living. A lot of this too, with me working in this environment, I really want, when the patient comes in, they are either feeling quite down, they can't believe they've been through something like this, if it's a heart bypass or anything, that it was healthy, I don't know why this happened. Everybody has a different bit of emotion. Your body could go through a lot of emotions too, or even with people that do have open bypass surgery, can bring on a lot of different emotions that they're not used to, very sensitive. Our goal is to build the confidence, not only with exercise, and it's amazing because they feel like they can't do anything because they just are been through quite a bit. Maybe they came in healthy, maybe they came in with feeling very sedentary. So when we sit down with the patient and we're counseling them on their first initial assessment, we create all these goals. I want to know what they were doing in the past. I want to know what they would love to be doing. And that quality of life is so extremely important. But again, gaining strength and endurance throughout your whole self, not just the heart, but even throughout your whole body, is amazing what that patient can do in about 12 weeks. And even doing just a testing of a 6-minute walk, they're like, wow, I haven't been able to walk that far since the surgery, or, so there's a lot of things. So I always call it a wow factor of from the day I get the patient in and the very last day when we have to discharge, we gain quite a relationship with the person, and we tend to really get into their lives and as much as they will let us. But I need for them to feel good and to get back to doing things that they were doing before, maybe even feeling better. So it takes a lot of time, and you really get to the end, and it's a very satisfying job for me because you've helped this patient and you feel it. It's almost very tearful on their last day because it's like your kid is going off to college now, and it's just a wonderful experience of how far they've gone. And our hope is that they continue everything that they've gained throughout the 12 weeks that they are here. So what happens, I want to get back into the exercise. So what happens to our heart when we exercise? Obviously, our cardiovascular health, exercise, physical activity, all affects our heart, veins, arteries, etc., blood vessels. Main thing is that we want to do aerobic exercise because that's what's going to give oxygen. It fuels our muscles. So like walking, jogging, biking, that type of thing. I want to give you a difference between exercise and physical activity too, is that there's exercise, which is actually a dedicated point of your daily routine. Like, hey, I'm going to go out and I'm going to walk for 30 minutes. Physical activity is all the things you're doing throughout the day that requires being physical. It could be anything. It could be chores, gardening, daily house stuff, all that, everything between. So I kind of divide that up. But if you get both together, you're going to feel better instead of sitting on the couch and not doing anything. So why does aerobic exercise decrease our chances of developing disease to our cardiovascular system? Because I bringing up the heart chart here, and it's very technical, but I don't want it to be that way. This is giving you a diagram of the heart. Most importantly, I'm going to have Alyssa switch to the next slide too for me. Your heart is the main organ to get all this oxygenated blood throughout your body and muscles. So it goes by the aorta. And so Alyssa will take her lovely, she's like Vanna White for me. So our blood's coming in through where she's pointing into the left pulmonary vein. So that's where your blood's coming in through, and it's pushing through that left ventricle. And that left ventricle is a really important part of your heart, which everything else is too, but it's going to help push out the blood all the way out to the top through the aorta, and that's going to go to your whole rest of your body. And this is oxygenated blood. And with exercise, you can switch to the next one there. Once you start exercising, all of a sudden you can feel like, well, man, my heart, I'm going faster. Let's say we're walking, I'm going faster. My heart rate's getting higher. My blood flow is increasing, and it's requiring the muscles to demand more oxygen. So, and your heart rate, as it increases, is causing that left ventricle to pump blood to the body even better. So over time, regular exercise, left ventricle becomes stronger when receiving all that oxygenated blood. Muscles, they want to be used. So your heart muscle is that's your important organ. The stronger you have that heart muscle, the better and efficient it's going to be. Our muscles not only, so when a patient comes in, we're like, okay, this is what we're going to do for your heart, and we want it to make it better. But not only that, you're getting like a 2-for-1 deal here. So you're creating even strength and more endurance throughout your whole body. And those muscles are so important because they're holding your skeleton up. If you don't utilize those muscles, they are weak, not strong enough. That's why you feel so tired all the time, because you don't have that strength to hold your body up, your skeletal system up. So it's just like a reverse cycle. So the more you don't do it, the worse you're going to feel. So I don't want to talk about the adaptation. Excuse me. The adaptation, there you go, to aerobic exercise. So at rest, the heart adapts. So it's holding more blood, pushes out more force with each beat. So our heart muscle is strong. So we want to create less strain, which creates a lower resting heart rate. And with exercise, it's kind of like athletes or marathon runners or anybody. The more you exercise, it's actually decreasing that lower resting heart rate, which we want. Because if your heart rate is going too fast at rest, you're wearing yourself out. It's basically deconditioned. So if exercise comes in, it's making that heart muscle stronger, causing less strain and be able to push more volume of the blood out into your body. So what happens to our arteries? So this is one thing too. So I kind of talked about the heart and what it's doing and pushing that blood. So the arteries, another huge thing. So this all comes together. So we talk about arterial compliancy. So as we age, our arteries lose that compliance or that elasticity, and it creates stiffness. And that affects how our heart pumps throughout the body. So what we really want is for these, the normal artery itself, and Alyssa, you can point to the lining of that for me. We want this to be very elastic. So when a big volume of blood is pumping through, it expands and lowers, expands and lowers. With exercise, as you're pushing and pushing and pushing and making that blood flow through, it dilates it. So it's creating back and forth, up and down, widen, narrow. So it helps with the elasticity. Compliance is natural for the arteries to expand and contract as blood flows through, especially the high volumes. And you can see in the bottom here too, where you can see where the plaque starts to form. And you can switch to the next slide for me, Alyssa. So if you're not compliant, if arterial stiffness occurs in the heart, it's going to work harder to push that blood through because it's constricted. And I know there's other more technical or more through the membranes and the lining of that artery that comes involved, but I want to keep this to basic because it really, it pertains to your blood pressure too. So a lot of people come in with high blood pressure and they haven't exercised, and all of a sudden we get them to exercise. The first resting blood pressure is pretty, almost normal. It could be high. When they exercise, it peaks up. And then as you keep going, that blood that's pushing through the arteries is actually expanding them. And it's creating a nice blood flow because it's widening those arteries. So that makes it a little bit more elastic. So then you're naturally at the end are going to have lower blood pressure. That's why exercise is so important. And it's, free too. So if you don't, if that is something in your life that you're not adding in, it causes so much strain over your heart over time. So then I always have those, oh my gosh, but wait, it sounds like an infomercial, but there's good news. The exercise is definitely going to reduce that, especially regular vigorous exercise. So it's going to slower the rate of the stiffening with age. There's a study I just read the other day when I was looking up some of these factors too, but they did a 3-month study on people that were not active at all. And they were studying the arterial stiffness in their arteries. So nobody was active. So for 3 months, they went to an exercise program and it reversed the arterial stiffness. So they actually can do it. It's never too late. There's always hope. And that's the biggest thing is to actually think. I know there's a lot of scary parts about this and to start the program or to start just even exercising, you really got to dig deep and think, okay, if I have high blood pressure, if I have high cholesterol, I have all of this. This is one thing that you can do, exercise, one thing you can do, and it can be free. You can go for a walk for 30 minutes a day, and it's very helpful. So let's go to the bad cholesterol and plaque. So again, here is an image of the artery. So plaque will gain an attack and gather in that artery and build up, which is going to restrict that blood flow that we don't want to happen. So we want it widened up with blood and exercise flowing through at a faster pace. It will definitely, help remove that plaque and make it widen. There's other risk factors that are involved with that, but exercise is really a main prevention. So what happens when that builds up, it actually can break off, and the red blood cells actually form clots. And then it can be totally, completely constricted. So for a brain, if you have a clot that goes out to the brain, you have a stroke. In your heart, you have a heart attack. And that's what we want to prevent. So with exercise, again, here I am talking again. When it is flowing through that area, it's going to widen that out. Take some of that bad cholesterol with, and the good cholesterol is taking it away. And you can see how easy that is to get atherosclerosis and blood clot in that. So that's why I really encourage the exercise. Obviously, medication, your food choices, all of that is so important. But I know there is this program, which thanks for moving that on me, Alyssa. I appreciate that. There's this movement that means the world to all of us cardiac rehab people. It's a national initiative to prevent 1 million heart attacks and strokes over 5 years. It's called by the CDC and CMS and federal agencies and private sector partners. What's called Million Hearts. This is a group that has so much information on it. It's part of our cardiac rehab. It's part of our AACVPR. So it's quite a mission, and I encourage anybody to go on their site. There's so much information to help out if you have questions, concerns, anything informative. Just a super great resource for anybody to go in and look at, and it's pretty simple. The other one I really appreciate that they actually brought up on the Million Hearts is Walk with a Doc virtual series. So basically it's a live series, and you're with a doctor and you start out walking with them, and they're going over like education as they're walking. And it's really a cool thing. I just actually found that, and I thought that was I listened to a couple of them, but another resource, you want, some extra incentive. You're learning, you're getting some pretty cool doctors out there helping you out, and they're walking too and keeping things really simple. But they talk about all kinds of different subjects. So it's a great, I wanted to give resources for people to be able to reach out and help themselves. So we are going to transition to Alyssa, and we were again talking about, well, this actually comes back from way before when, as an exercise physiologist, I was getting stuck, especially with COVID and being deployed to other places. And I was stuck and I wasn't exercising, and I could totally feel it. And I reached out to my best friend, and I know what she does for a living, but I'm like, I need help, I'm stuck. So she created this, and she's like, Linnae, it's really healing from the inside out. So there's so much more than just the exercise. There's all this well-being, and within myself, I wasn't forgiving. I was putting too much pressure on myself and getting very down. And I am going to hand it over to my best friend there, Alyssa, to go forward with this part of the.
Thank you. Can you hear me okay? Sometimes
Yeah.
my microphone's weird. Okay, good. Hi, my name is Alyssa Gawboy. Formerly, my maiden name is Alyssa Smith, and I'm actually from Menomonie, Wisconsin, and I grew up there. My dad is still there. I did my undergrad at Stout, and now I live in the beautiful Brainerd Lakes area. And got married, and so I've had a very interesting, I don't even know what you'd call me now. Now I own my own business called Limitless Wellness. Linnae and I were talking about, how we were going to develop this and do this. And basically, with my business, I work with people who want to get stronger. Maybe they have weight loss goals, or maybe they're just not in a good spot mentally, and they know they need to improve their health. And so I worked in gyms and hospitals for a while, and I worked with nutrition and a little bit of exercise, and I got really burnt out of the gym setting. And, when COVID happened, I was working for a hospital at the time, and I was working from home in community health. And I had all these clients, my old clients, come back to me and saying, I'm really stuck. I'm not in a good place mentally. I'm stuck at home. I can't get to the gym. I'm not eating healthy, sitting on the couch. And so I developed what I felt like a lot of other programs were lacking in this area. And, a program that truly looks at the whole person. So we are each a 3-part person composed of mind, body, and spirit. Many of us have learned how we should take care of our bodies, but few of us have learned how to take care of our souls. So our soul is the core of who we are as a human being, and it truly is the heart of the person. This part of us is often too neglected by society. We are more inclined to first preach at, teach, or try to fix people rather than taking time to really get to know a person. So what a person thinks, feels, wants, and needs compromises much of who a person is. People need a safe place to be accepted where they are at. They need someone to listen to them as they feel and process all that is going on within them. And I say a lot of the times, feelings are for feeling, not fixing. And so kind of just going back to people that know they need to make changes. They know they need to maybe eat more nutrient dense foods. They need to start exercising, but they're not motivated to. It's not just going to work to just tell them you just need to start doing it. Okay, so you have to look at the entire person. So allowing people to express what is going on in their hearts and minds gives them the ability to grow beyond where they have been stuck. So the preaching, teaching, and the fixing part of it will come later when a person is in the right position to respond. If a person has all kinds of static going on in their soul, it would be very hard for them to tune into what someone is trying to say, even if what they are saying is the right frequency. So what do we need to do first? So even before any of this, we first need to be accepted just the way that we are. We need safety. We need time to let our minds catch up with exactly what is going on to us. We need time to process and to face the realities that are ours. We need to admit the truth, feel what we are really feeling, and be where we really are. We need to feel safe enough to unburden our hearts in order to come to grips with whatever is going on inside of us, and then being able to get it off of our chest. People who do not really realize how necessary and how important it is for recovery will not see the need for this type of healing, truly healing from the inside. They will not have patience for it. They will care more for their own opinions, agendas, theology, interpretations, and sense of propriety, rather than they will for the long-term emotional well-being of the person in distress. They will tend to want to resort to the quick fix, jumping right in to try to correct the person and help them see the light before they have taken time to find out what's really going on inside them. So most people want to change or want to have change in their life for negative reasons. Okay, so I want you to think about, like, if your goal was to maybe lose a few pounds, okay, maybe you put some weight on during COVID and you're like, all right, like, I hate my body. I hate the way I feel. I'm gross. I'm ugly. So all of these are negative reasons, okay? Or they are desperately frightened, tremendously fed up. They can't take it anymore. Or they know there has to be more to life than this. So in other words, they do not seek change out of the love for something good that they really want. They're acting out of fear, contempt, and desire to get away from something that they do not want. So they're like craven slaves running with the lash of a cruel taskmaster. Fear, shame, and desperation, and an intense need to solve problems energize them. So there is this law of creation called the principle of sowing and reaping. So if you're motivated by negative reasons, you're going to reap negative results. So fear, hate, contempt, and desperation cause well springs of negative energy to generate deep within you, and they will spill over and contaminate your life. I see this a lot with clients. So if they have, let's say, a weight loss goal and they want to lose weight, but they're only motivated by these negative reasons, their experience throughout this process is very negative. They always are going down that negativity chute, and our minds follow the path of least resistance, right? So if that's what we keep feeding it, we keep going down that hole, well, the process of weight loss or whatever your goals may be will also just start to reap negativity on your entire life. So one of the things I do is really try to get the clients to focus on the positive. So when you lose this weight, when you do exercise, like, why do you exercise? What are the positives out of it? And really start reshaping their mind that way, instead of like, I exercise because I hate my body. And maybe you've heard this, I exercise because I hate my body, or I exercise because I love my body and I know it's good for me and I know it's good for my heart. Yeah, so it's crazy to fill your life with that kind of negative energy, right? And it's absurd to have what you hate and fear become your major fuel and motivation source. Again, you're just going to wreak negativity on your entire life. Your family's probably not going to be very happy with you. Your friends aren't going to be very happy with you. You're just be a very negative person. So the absurdity is that in order to continue being motivated to exercise, eat healthy, you must have that continued presence and influence of what you cannot stand, if that is your motivation. So in that case, such things will completely overshadow and engulf your life. And if they go away, you will run out of motivation. So if someone's motivated by weight loss and they hate their body, okay, they lose that weight. Well, what's their motivation? They don't hate their body anymore. So what's going to motivate you to keep going? Okay, so you need to find a different type of motivation. So there is a better way. So you would do well to adopt this as an ever-guided principle. Do not do anything out of fear, anger, disgust, or desperation, but let the love of God and what is good, true, and right be the energy that motivates and spurs you on. Love the personal growth, maturity, and fulfillment you will develop as you learn to face, accept, and garden your reality. Love the freedom you will have when you no longer dread and run away from the truth. So remember, weeds beget weeds, wheat begets wheat, and positive ingredients beget positive results. So be a free lover, not an enslaved, fear-driven, negative critic. And this is how to remain healthy, strong, effective, and successful mentally and spiritually for those physical results. Neurological researchers estimate that 75% or more of what is programmed into our subconscious mind and wired into our brain is negative, counterproductive, and self-destructive. It's like having a computer that runs your life, okay, but with 3 out of every 4 pre-programmed commands being wrong, okay? Then that is a formula for failure. And I feel like even, okay, let's look at when you wake up in the morning, like, what's the first thought? Is it negative or is it positive? And for most of my clients, I mean, I think they've changed a little bit, but I mean, usually it's negative. I didn't get enough sleep. I'm tired. I want to hit snooze. I don't want to get up. So I guess this example, so 75% or more of what is programmed into our subconscious is negative. I mean, that kind of just goes to show, yes, it's very true, even from the first second that we wake up in the morning. And so, I'm a dietitian by trade. We'll talk a little bit just about nutrition here and say that what goes into your head is more important than what goes into your mouth, okay? Because one directs the other. Eating because of stress, boredom, habit, or any other satisfying or distracting reasons will keep you unfit and unhealthy, okay? So I think this is one of the most overlooked aspects of staying healthy and fit. Every area of your life affects every other area. And this is why I started my business, this holistic approach. So it sounds funny, but most self-help, diet, or spiritual books only focus on one aspect of a person. And I'm convinced that you must address the whole person for complete and lasting results. It's like if you were to buy a new car and the only type of maintenance you ever did was filling it with gas, like you never rotated tires, never got an oil change, you never did any of those things. So the exercise and the nutrition part, you're really only feeding one part of the person and you're not taking care of the entire car. You have to take care of your spiritual health. You have to take care of your mental health. It all affects each area of their life. So what I found is if you're weak and tired because you aren't taking care of your body, your mind and your spirit will also be suffering. If you are mentally weak, your body and your spirit will suffer. If you're spiritually bankrupt, your body and your mind will not operate at peak performance. So for this reason, that holistic approach, including physical, mental, and spiritual fitness, is the most effective route to living a life that will empower you to fulfill your purpose. And I feel very blessed to be talking to a congregation today because my program stems off of spirituality, and we know that once we have that firm foundation in Christ, a lot of other things blossom and take care of themselves. But if we don't have that firm foundation, things can fall apart pretty fast. So every action in life is preceded by thought. We are what we eat is a much used quote, but I challenge that statement because we eat based on what we are thinking, okay? So that thought has to first enter our head before we grab the food. So thought is the seed that blossoms into the lives that we live. So plant good seeds and you will get a good harvest. Plant bad seeds and you will get a bad harvest, okay? Back to that sowing and reaping principle. Have faith that God is always guiding you in the right direction. As you seek his face and follow him, he will move you along the right path, sometimes giving you detours along the way, okay? So when you arrive at that intended destination, you're also the person that you're meant to be, okay? God has a beautiful plan written for all of us. And, sometimes we can't get to that end goal because we're just not ready. God hasn't, taken us through these detours and taught us things because we're not ready for that yet. But everything is going to be okay in God's time. So what you put in your mind is up to you, okay? Totally up to you. You could take nothing away from this presentation or you could take some things away. You put garbage in and you will get garbage out of your life. So, man, I feel like this is just so relevant when you look at someone's really bad eating habits, right? If they have bad eating habits and they're eating more calorie-dense foods than nutrient-dense foods, well, if you're putting that garbage in, guess what's going to happen to your body, okay? You probably won't be as strong or fit or healthy, okay? And it's almost the same way, like if you're not making good choices in life, do you think you're going to have an amazing life, or do you think you're going to have all these different issues? So anyway, you put garbage in, you get garbage out. It is up to you what you think about, what you allow yourself to focus on, and what you let penetrate your mind. Your actions and your life will be greatly affected by what you are thinking about, and that's the mental piece there. If you are thinking about all great things that God has in store for you, or on the pure, the lovely, and the beautiful things in life, right? So Philippians 4:8, focus on whatever is true, noble, right, praiseworthy, all those things. You will have a much different view of your life than if you're focusing on the negative things in this world. So take control of your thought life and you will take control of your life. So what you think about is what you believe to be true. I encourage you to learn and accept your God-given identity and purpose. Develop a deep respect for who you are and why you are on this earth. Garden yourself for the glory of God and for the fulfillment of the purpose that he has given you and the dignity that he has placed upon you. I think now we're going to open it up to questions. So if let's see.
Alyssa and Linnae, thank you so much. Thanks for reminding us of the numerous benefits of exercise and helping us take care of both our physical and our metaphorical hearts. I do want to open it up to everybody else on the call this morning. We have, let's see, 10 or 15 minutes for some discussion and questions. And I'd love to hear what the rest of the group is thinking.
Our kids are letting the dogs outside, so I apologize if there's noise in the background. But I just wanted to ask Linnae, you kind of touched on this a little bit about being active rather than just focusing on exercise, and kind of getting both. As a family doc, I talk a lot with patients about their non-exercise activity time, or NEAT time, and how that's really important to increase that. And you both talked a little bit about not sitting on the couch and moving your bodies, but do you advise patients at all specifically on ways to increase their NEAT time?
Absolutely. Absolutely. Yes. it's hard because if let's say they're a hard worker, during the day they're working and it's hard work, and yeah, I get it, it's hard work. But then I still want them to go ahead and do their exercise when they get home or whenever they can fit it in. That exercise that you're putting aside is the one that's going to gain you strength and endurance, to be able to do what you're going to do all day for work. The more people sit around, especially you get a lot of that too, because they feel like, well, when I move, it bothers me, or I get short of breath or whatever. You're losing all of that muscle strength if you're just sitting around not doing anything, and you're gonna just cycle into this feeling even worse. I talk about, the drain. You're constantly going down this drain if you're not gonna continue to get up, move around, be more. I mean, it's really hard too when you can't get outside and do exercise or whatever. But the more I can give you chair exercises, I can give you hand weights. There's several things that we offer to get them moving more so at home. A lot of times they're scared, but it's kind of like too, when you feel anxious and you're procrastinating, just doing one little thing towards that activity can actually boost your self-esteem. Like, wow, that made me feel better. I actually got something done. You're not cycling backwards. So I definitely encourage it all the time to make sure they're being active throughout the day, not just, doing their basically daily living activities is a lot of work for them. But the only way we're going to be able to do it is, you got to try and do it, and we got to build your strength up in other ways. So we take any kind of resource we possibly can that they have at home, and I give them a lot of exercises to do, flexibility, stretching, different kinds of yoga, that type of thing is very helpful, that they can do at a very low level fitness ability. So it's quite important, but the person has to and want and needs to want, so that when they come into rehab, it's kind of like a realization, like, wow, I actually did that. I actually got on the treadmill and I walked for 3 minutes. It's a big thing, but that's the way they're going to feel better about doing things at home. And it's a stuck situation for emotions. So if they're down in the dumps and whatever, this is just one way that hey, I'm right here, guide you, you can do it. And then they do it. Then I'm like, see, now you can do that at home. So it's so important to be active throughout your day. Obviously, everybody needs a day of rest. And I highly recommend that. But if they're always constantly just hanging around and not doing much at all, they're not going to get that strength going, and they're not moving towards that exercise goal either. So it's very important that I always divide that up between your actual exercise and your actual physical activity. So they're going to heal better and faster the more they move. Does that answer your question?
Kind of. I think your emphasis too on just getting started and taking those baby steps is really important. I guess I was thinking more about, what I talk to patients sometimes is, if they have a physical job, if their tendency is to go into their break room and just sit during their break, maybe it's better to try to, take a lap, do a walking before you sit down, or sit down for 5 minutes and then get up and walk around a little bit, just to kind of keep the body aware that it needs to keep moving and burning those calories.
Definitely. A lot of people that are patients that come in and they're working, and I'm like, well, what about your lunchtime? If you need to do 10 minutes, whatever you do, it actually, it breaks your day up.
Yeah, or take a walk as a family after dinner or something like that, to, instead of flopping in front of the television, kind of go out and do something, with you, find time to talk with your family. But that might be a fun time to get that Walk with a Doc website.
Oh my gosh, I loved it when I saw it, and I just totally thought of Dr. Horvath, because I'm like, no, he would do that. It's really cool. And they're very sincere and fun, and so yeah, it's a good resource. I highly recommend it, but I'm very knowledgeable.
Mm.
Becky,
Um,
go ahead.
Hey.
Hi, thank you for being with us today. One of the things I do through church is I'm a parish nurse at our church, and I encourage folks to keep active, which has been very, challenging during COVID. But we have, so a bunch of us now are on, it's called Strong Bodies. It used to be an in-person kind of event but with COVID it can't be. So now it's online, it's virtual.
Oh, wow, good.
It's amazing. And I can put it in the, I don't know if I have the thing right here, but I know Sally's on it and Deb's on it. And you do it twice a week, or you could do it more if you wanted, but Monday, Wednesday, Tuesday, Thursday. It's through UW Extension, and it's an hour long. It's amazing. And they do, what I love is they do the regular, and then they do the adaptation. So if you aren't able to get down on the floor, this is how you can do it in a chair. It's wonderful. And they'll have like 130 people on at one time.
Oh my gosh.
Yeah.
That's awesome. Yeah, I would love that resource. It's a good, another good idea to give out. Mm-hmm.
Yes, I will see if I can find it quick. The other thing that I've started doing as my body ages is stretching. And I found that really, really helps because you get, especially when we've been sitting more, it's like you get sort of everything gets tightened up, and that's stretching, and I need to do it every day. So
absolutely. Especially as we age. And I never thought that I could never not do some of the things I was doing when I was younger, but I got out of the stretching and flexibility, and I started doing it with my patients, like with them in a group when we could do group. And it's amazing of what it really does. It makes you feel better, especially when, like in the mornings or when you're just not feeling good. A lot of our coronary bypass patients, they're just miserable, and they have an incision, maybe the sternum is cut open, and their posture changes, and they're protecting their chest. And I'm like, hey man, I want you to move do the movements with your hands, do the flexibility, you do it slow and control, but even that blood flowing throughout that area, it just makes them feel better. And it's just, any kind of that stretching is so important.
That's good. She's not saying much.
Mike and Sally, I see you came off mute.
Yeah. Hi. I just wanted to say both of us are taking that Strong Bones class that Becky recommended.
Mm-hmm.
And I think the next time we register, we'll try to sign up for both sessions. So it's Monday, Tuesday, Wednesday, and Thursday. And I'd like to say a shout out to Alyssa. She used to be the great babysitter for our grandkids.
All three. Yeah.
Love this.
That's awesome.
Love your message, Alyssa. It was very good.
It's very, very good.
Good to see you both on here. You were late to pop on. I was like, I know them. Small town. Total.
Jan, I think I saw you raise your hand.
Well, just kind of, this is just a comment because I don't really have a solution right now, but bringing exercise together just with the socialization and the positive feelings you get from being with people is obviously lacking. And I hear that around town all the time. When is the senior center going to open? When are we going to have classes again? And I mean, they're so tied together, and I always hear such positive comments from cardiac rehab patients because they just love going there. They love the staff. They love the joking around. There's so much going on there, which is not going on here. I know Zoom is something, and it's hard to get motivated to go onto Zoom because it's like, well, you're in your house, and I don't know, I don't feel like doing that now. Whereas when you went to classes, you were accountable. Your friends were there, you know, so it's just so different. And I just hope that somehow we can get the senior center open and get some classes again, because people are so missing that part of it.
Exactly. It is such a struggle. I mean, I know some of the health clubs are open too, that you have to be, obviously use your precautions and be very careful. I'm pretty sure a lot of the gyms are, but it's a different, type too. But it's, we're all going through this pandemic, and it's really bringing us down where it's winter. We can't get outside and do all the things when we first started in the pandemic, where we were able to get outside and walk or hike or do all the things we loved. And now we're we're stuck with this lovely winter situation, unless you're really good at winter sports and enjoy it. But it's hard. And I love the virtual. I love that. I know many times I will call Alyssa and be like, I want to do something over FaceTime, or let's bike together, and we can get on our bikes and do the virtual too. But it's so different now that how are we gonna? I want things to open up. I want our wellness fitness centers to open up. I want the senior center to open up, because we do need that social. We do need that accountability. Just one fact too, we during when we were actually closed for rehab, we did virtual rehab. We're still holding them accountable, but it wasn't exactly the same as bringing them in to rehab. So the results were different, but yet we're still able to keep track of them. But exercise-wise, you're right. The socialness, hey, okay, well, I know someone's going to be there, so I got to go, and we're there together. And when you form that companionship, and it's just such an important thing. And I think too, I just really wish that we can all open up again and have that, because we need that. We really do. That's how we're going to get through this, by taking that exercise away, that opportunity for social and accountability and all that, and not to be able to meet in person. That's not helping us become better. It's not creating better wellness for us. I know we want to be safe and have all the precautions, but it's such an important thing. And I just totally agree. My hope is that we get back to doing that. That's a way we're going to heal from this. It really is to get back to that. I really do. Deep in my heart, that's one of the hardest things for me to hear when we are closing things down. And it's for the better for us. We need that exercise. We need that time. We need that social and accountability. And when you're feeling so down in the dumps and you just are stuck, as I would call myself stuck, because I was home, I wasn't going to my gym. I couldn't, and I would be stuck, go to work and be at home. Well, yeah, it was very effective for me, or destructive. And the only way we can move forward with this, and thank God we have vaccines and things are coming or going forward, but really want that to happen, and don't take it away from us, because we need that health and fitness. We really do, and social.
Well, Alyssa and Linnae, I want to just bring us to wrap up here. It is getting time for us to transition. I want to make sure people have time to get to the church service at 10:40. Thank you so much. I can't tell you how appreciative we are. We've learned a lot about the various benefits of exercise and really the value of bringing activity into our daily lives, both from a physical as well as an emotional and spiritual, mental area, improvements for our health. Thank you so much. We will do our best to post a lot of these resources. Thanks for those who have dropped them in the chat box. We'll try to get those included and sent out. We'll get the video edited and posted on the church's YouTube site so we can refer to that in the future. Alyssa and Linnae, thank you so much. Wish you all a wonderful day, and stay healthy.
Just a quick plug for next month. We will be actually having Laura Knutson, the dietitian from Red Cedar, come and speak with us more. So kind of be able to pick up right where the two of you left off for us.
Good.
That advice that you've given today, so that we can continue our focus on physical health as well. So
thank you. Thank you very much, Dr. Horvath, and everybody for inviting us. And thank you, Alyssa, for being my partner in crime on this. I love it. This has been an honor. We really appreciate it.
Well, thank you, everybody. Have a great day. Take care.
Yep.
Take care.
Yeah.